So I'll just talk briefly about research. And we all agree that research is important. Investing in research is important in improving our health outcomes, our healthcare systems, and addressing issues of inequity. And it's said that it's documented that Africa produces only 2% of research globally, while Africa accounts for 25% of global burden of disease. And this 2% of research, I'm wondering, it's not documented how much is coming from the nurses. Nursing research has been there since the days of Nightingale. Nightingale was our first researcher during the Crimean War. And since then, we've had advances in research. In the 70s, we had more nurses coming in, learning to do research, and most of the research then focused on education. Later on, in the 70s, we had more nurses starting to do research in clinical areas, and most of these nurses were from the Western world. With more advances in the 80s, we've had a lot of improvements in technology, and that has enabled nurses to do research all over the world. Improvements in skills as more people are being trained to do research. Improvements in funding for research. Some countries, like in the US, they allocate funding for nursing research, unfortunately not in Africa. And improvements in even dissemination of research through journals. We had our first journal, nursing journal, in 1965, the American Nurses Journal. We've had many journals coming up, and I don't know whether our journal is still active in Kenya, the Nurses Journal. So the goal of nursing research actually is to inform nursing practice. Through evidence-based practice, which is the current movement, we are able to generate knowledge. We are able to generate new tools. We are able to generate solutions to address healthcare problems, and both at the clinical setups and in the communities. So in brief, research bridges theory and practice. Research happens in various areas, in clinical setups, in communities, as we've had presentations from here, and in universities, where most of the research is conducted. And what are the challenges in nursing research? Because right now, as we speak, there is the global gap, but within the healthcare profession, among the healthcare professionals, we see a lot of research also coming from the West. In Africa, most of the challenges that we have relate to resources. So we do not have adequate resources. We don't have a lot of funding for research is generated externally. We do not have domestic funding to support research. Yes, we have our NRF, but how many of us have received funding from our NRF to do research? None. Okay, who is getting this funding? And the other challenge is capacity. Again, most of us are doing clinical work. We would wish to progress, do masters. Of course, there are opportunities. We are growing, but we are still not there yet. We do not have adequate PhD programs. We do not have adequate postgraduate programs. And even those that are there, we still lack resources to support, to have a mass of nurse researchers in the country. The others are institutional challenges where we work at. Some institutions do not have strong research policies to support us to do research, and we also do not have adequate mentors to do research. Some of the researches that we do, most of the research that we do are in public health, in community health, and we are really promoting clinical research. This is an area of gap. So in the future, for future considerations, what should we do to improve our output of research? We need to invest more in clinical research, because that's where we operate more. Of course, community research is important, but there are many players, yeah? So we need to work with other professionals. We need to promote interprofessional research production. And this is working with other professionals in the healthcare setting within our country, but we also need to promote working with the collaborators from externals, especially in generating research, writing grants. There are experts there who can work with us to write grants, and there are a few people already working with externals from South Africa and other countries to do research. We can partner in publishing. Those papers that are presented, don't publish our own. Don't publish, don't be too mean. We can produce better papers if we work with others. Let's embrace working together to publish, to supervise. We need to strengthen supervision of research. It's a gap. When someone is presenting, a PhD, a master's program, you can tell where the gap was in supervision. So we need to strengthen that. And then we need to advocate for more domestic funding to support research as much as we are looking for external funding. And finally, we need institutional strengthening. For those who are in universities, in colleges, we need to advocate for better infrastructure to support research. I'll stop there and wait for questions. Thank you.